courtroom scene.
And good afternoon, everybody. I'm Scott Swan. We're interrupting Dr. Oz here for our daily briefing from Eric Holcomb, the governor of the state of Indiana. He's over at the State House today, just minutes away now from giving us an update on the coronavirus. Of course, all of us have now been exposed to this stay-at-home order that is now in effect across Indiana right now. And the state health commissioner is at the podium. Let's go ahead and listen in.
Every day, especially as testing increases across the state. To give you an example of that increase, this time last week, 243 tests had been reported to ISDH. As of today, we reported 3,356. About 14% of those who are being tested are testing positive. While this rate may seem high, it's expected because we're testing the highest risk individuals, those who are ill, and those who are at high risk for exposure because of where they work or whom they work with. We've received our second allotment of supplies from the Strategic National Stockpile, and we're currently working through a plan to distribute that in the next few days. That included gowns, masks, gloves, and face shields. We'll be distributing those to hospitals and counties at the greatest need, and we'll continue to do everything we can to support our healthcare workers on the front line at hospitals, EMS, and long-term care facilities as they encounter shortages. I've been holding regional calls with hospitals across the state to discuss what they're doing now and future planning so that when this outbreak peaks, we are ready in all corners of our state. I want to emphasize that this is not just a state health department response. We are engaging our state partners, our counties, every hospital system, our local health departments, and our federal partners. Just as we've seen Hoosiers step up and look out for one another, we are also experiencing incredible collaboration and partnership across our state, for which I am truly grateful.
Thank you, Dr. Box. Dr. McCormick, if you would give us an update on the work that you've been accomplishing with the FSSA and some child care options at our schools.
So good afternoon, Indiana. I'm Jennifer McCormick, your state superintendent of public instruction. I first of all, again, want to thank our local schools for the work that they continue to do. They have been nothing short but amazing. Also to the students, I'm speaking to you again. Make sure you are working hard, make sure you stay positive, and make sure you are being a good partner during a very difficult time. To our families, I'm very aware of the hardship, and I appreciate the support that you are providing to the Department of Education and also to your local schools. The Department of Education has determined that we have 4 priorities during this difficult time. The first one is ensuring essential resources are getting to our schools. Our second is providing academic support. Our third is engaging educators. And our fourth is preparing guidance for our schools and for our districts so that they can prepare to operate now, in the near future, and in the long term. Today we're here to talk about child care. We talked about hardships on families, and we are very aware of that. Dr. Sullivan and her team and our team has met several times to discuss what are the good options. This is very difficult. We are trying to determine region and areas within the state where the need is the greatest. We are also well aware we need to target our priorities to healthcare, hospital providers, and public safety employees. The last survey, which was last week, March 19th, which honestly seems like months ago, but that was our initial survey on collecting information on where that daycare lies. At that time a week ago, we had 50% of our districts that signaled they had some type of childcare available within their communities. Our charge under the governor is to expand that and making sure that we are taking care of those who need child care so they can operate for the essential needs of the state of Indiana. So we will continue to work forward. We have provided guidance to schools. This is not mandatory. We are going to determine where those needs are, contact those superintendents within that area, and proceed on. Another area that we're trying to be helpful is in the area of healthcare with the PPE issue. Our schools, whether it's science labs or career technical education, have signaled to us that we have gloves, we have masks, we have gowns. Where do you need them? So our team is working with the Emergency Operations Center to determine what that distribution looks like so that we can be a good partner in making sure our healthcare folks have the gear that they need. And we don't have mass amounts. It's not going to accomplish everything we need at this time, but anything we can give at this point is helpful. Again, we know there's hardships for families. Just be assured that everyone on this stage, everyone at the Department of Education, people at the local level are working hard to find solutions. Thank you.
Thank you, Dr. McCormick. Secretary Schellinger, I think you've probably been on speakerphone. You haven't had the phone in your hand up to your ear, but I think you've gone over the 1,000 mark. Probably feels like 1,000 calls in one day. But can you share some updates on what you've been hearing and guiding?
Thank you, Governor. Good afternoon. My name is Jim Schellinger, and I serve as your Indiana Secretary of Commerce. And first off, on behalf of the entire IEDC team, our hearts go out to Hoosiers all across our state during these challenging times. As most of you know, the Indiana Economic Development Corporation is responsible for the coordination of commerce statewide in Indiana, and that is our focus and has continued to be our focus. The IDC works with over 700,000 businesses. 512,000 of those are small businesses of 500 people or less. But we work to assist them with job creation, with their payroll, and with their capital investments in Indiana. And while we continue to have this as our focus, as the governor said yesterday, the IDC has been sort of a concierge service to all of our businesses throughout the state. We've been in contact with over 1,000 businesses last week alone, whether it be in advanced manufacturing, or aerospace and defense, or agro-biosciences, logistics, life sciences, or IT, and many, many other types of businesses. We've been in touch with them and reached out to them to say, here's the latest we can tell you from state government and from an economic development standpoint. But we want to hear what's going on in your world, and we want to ask you for suggestions on how you can help us with the issues and the challenges we face, whether that be with PPE or any other, and I'll tell you, as always, they've responded. We've reached out to the 92 local economic development officials throughout the entire state of Indiana, as well as the regional economic development officials to seek their input as well. We have vetted over 115 companies who have come to us that have expressed an interest to help the state in response to the manufacturing requirements and things for PPE, the personal protection and equipment. Our private partners, similar to the superintendent, they've just stepped up like never before. And that always has been the case in my 30-some-odd years in the private sector in Indiana, have always stepped up to the call. So whether it's Subaru, or whether it's Fiat Chrysler that's going to make 1,000 masks a month, whether it's Summit MMI, or Sangianovi who's donated gloves, or Ambrose Development who donated not only 16,000 gloves but also 8,500 meals. Our businesses have stepped up just as I expected they would, and the list goes on and on and on. You've heard about Hotel Tango and Cardinal Spirits, and the RV industry has stepped up to tell us that they have accommodations that could help us with homelessness and other things. When we needed evidence, when the governor requested of the Small Business Administration, requested economic injury disaster loan declaration, we stepped up and talked to over 500 businesses within a 24-hour period in 88 of our 92 counties to get that support. And as you all know, on March 18th, Indiana was recognized as one of the first states that would be able to apply for the Small Business Administration loans of up to $2 million per small business for helping their business continue forward. We have explained to all of our businesses that they can reach that assistance and fill out that application for a quick response at sba.gov/disaster. And of course, Indiana, we have 10 small business development centers throughout the state of Indiana that are out there available to everyone to assist in making that connection through COVID response at iedc.in.gov. So again, everyone's been working very hard. We have and will continue to execute and evaluate any and whatsoever we can help our businesses throughout the state and provide them support, whether they're small business, large businesses, or in between, in addition to the unprecedented federal support we've been getting. The good news I will share with you today is Indiana has been prepared for this type of event. The economic conservancy over the years, being able to say we have a AAA credit rating, being able to say we have a balanced budget, that we have cash reserves, have enabled us to continue an economic development standpoint through this crisis period. In fact, we've had 3 record years at the Indiana Economic Development Corporation. In the last 3 years, we've had record years with jobs, with capital investment, and with increased wages. This year alone, we've already, in spite of the last 2 weeks, we are outpacing those 3 years. We have 8,327 job commitments this year and already $1.2 billion in CapEx. So while that is not our immediate concern is the health of our workers and the health of our citizens, that's good for us as we get down the road we get into a recovery. We know that businesses have committed and they will continue to come and grow in our state. As recently as yesterday, we had a commitment from a large business from out of the country that's going to come here with 750 jobs in the medical IT business. So it's been interesting all my years. I've lived in Indiana my whole life. I'm 59. It's always been interesting for me to see that in the worst of times, Hoosiers are always at their finest. And I can tell you that the business community in Indiana is outreaching, working very hard to be of assistance to everyone, and has responded in the most positive of manner. Thank you.
Thank you, Mr. Secretary. Partner, you want to give an update on your portfolio?
Suzanne Crouch, Lieutenant Governor, partner to our Governor Eric Holcomb, and wanted to take this opportunity, first of all, to say in the midst of a challenging period, my spirits are lifted each day as I serve alongside Governor Holcomb and these incredible individuals. From Lake County to the Ohio River, from Evansville to Fort Wayne, this crisis has affected Hoosiers in ways too many to count. But please know that your health and well-being are the driving force of every decision that we make. My agencies are holding weekly stakeholder calls so we can stay connected to our partners, and our partners can stay connected to us. Over 200,000 Hoosiers are employed in the tourism-related industry. And with that in mind, I ask you to think about our travel and hospitality workers in this ever-changing situation. Find creative ways to show your support by shopping local when possible. And seek out virtual ways which you can connect to the services that they have to offer, like virtual state park adventures, historical museum tours, or interactive daily lessons from experts. And this information can be found on our Visit Indiana website. This is an extremely critical time for agriculture. Farmers have recently faced uncertainty with trade negotiations and inclement weather. ISDA is working tirelessly to ensure that our 94,000 Hoosier farmers have everything they need to plant their crops. Our farmers will continue to devote their lives to supplying Hoosiers with healthy, safe, and plentiful food options. Just this morning, the ISDA was on conference calls to our number 1 and number 2 trading partners, Canada and Mexico. And we let them know that while our borders may be closed, our relationships are strong, and we are planning and prepared for the future. In this time of social distancing, Hoosiers may feel more alone than ever, but social distancing doesn't have to mean social isolation. And that is why our broadband office is making sure that we keep Hoosiers connected. People need to connect with their loved ones, do telemedicine services, e-learning assignments, and telework, and so much more. We are seeing countless partnerships come to life throughout the state to make sure that Hoosiers can click, connect, and download, all while maintaining social distancing. We know that right now our main streets are struggling in our rural and urban areas, and our Office of Community and Rural Affairs is working to help ease their burden. In fact, earlier this week, in working with HUD, OKRA announced a COVID-19 response program that is utilizing our CDBG funds. Now qualified communities can have the flexibility to use these funds for a range of activities that help prevent and respond to the spread of COVID-19. This program could help fund anything from mobile testing areas to economic assistance packages for many of our small businesses. At this time of great uncertainty, housing stability has never been more important to Hoosier families. Our Indiana Housing and Community Development Authority has been in close consultation with our homeless service providers to ensure that they have the resources and the guidance and flexibility needed to provide direct service to our most vulnerable Hoosiers. We want to make sure that Hoosiers have a safe place to shelter at home and stay healthy as we fight this virus together. Governor Holcomb and I are doing everything we can to be sure that our frontline workers have the tools they need to get the job done. Governor Holcomb and I would like to say thank you to all of our healthcare professionals, and that includes those who are caring for our elderly and most vulnerable, and those who are caring and supporting individuals with disabilities. They are putting themselves at risk every day to save lives and help their fellow Hoosiers. This is not the first national crisis in the United States. However, it is the great challenge of our times. And let us draw on the strength and the example of past generations to answer this crisis with resolve, strength, and unity. And we will overcome this challenge and be a stronger, better nation when this crisis concludes. It is my prayer that we remain strong and vigilant, and that Hoosiers continue to put their health and their families first. Thank you.
Yeah, let me pass out a couple thank yous before we take any of your questions. First, I want to just publicly thank Cam Clark, the director of the DNR. As you may recall, probably a month ago or so, he announced that he was going to ride off into happy retirement, but he's reconsidered during this time of uncertainty, and he is going to stick with us and stick with it during this time of uncertainty. So I just want to thank Director Clark. I talked to Bob Vollmer about a month ago, the 106-year-old surveyor who'd spent 60 years working for the state, off and on in different capacities, and I asked him in front of Director Clark how the DNR was doing, and he said it had never been in better shape. So coming from Bob, I want to hold on to Director Clark as long as we can. Also, I want to thank, as Secretary Schellinger ticked off a list of folks all over the state, I too, and you see it, you're reporting on it, the good works that Hoosiers are doing. The Ball Brothers Foundation up in Muncie, Indiana, have created rapid grants. They've been dishing out resources and funding to a lot of very important organizations, community providers over the decades, but they've pivoted, and now they've got some rapid grants out there on the street already, 12 already, and then they've sent another 20 out, and they're helping EMS, they're helping their local police, they're helping behavioral and mental health service organizations get funding into the hands of the very folks that need it on the front lines right now. They've invested in some areas into telemedicine that's critically important at this time. Wanted to thank the Anesthesiologist Association. Also, they've created a statewide data center where they can track where all their ventilators are, and their anesthesiologists that may not be working right now that can also volunteer. This is going to be of great assistance should that day ever come. A few moments ago, I got off the phone with the Vice President, my immediate predecessor, Vice President Pence. He was just checking in. It just underscores how we're all in this together and connected on a daily basis. Was able to share with him what our concerns were. Obviously, I'm like most governors in the state of, or in the country, seeking Title 32 authority to help pay for our Guard. We're very encouraged by what we're hearing from the administration, and I hope that ultimate decision by the President will come soon. I was also able to talk about the N95 masks and how people are, as you heard Secretary Schellinger say, all over the state of Indiana. Folks are coming together and manufacturing masks for their local hospitals all over the state. In Northwest Indiana, the operating engineers, Local 150, sent word out to all of their vendors and contractors and said, we got to get the supplies directly to the hospitals in the region, in Elkhart and Goshen, in Elkhart County. Commissioner Yoder has put the word out, put the communication out that they're not trying to micromanage the needs, but they are doing everything they can to encourage folks who may not be working right now or who can work. Maybe they're retired. Like Boone County's got a sewing group on Facebook, and they're making masks and they're getting them to the folks that need them right now. Bill Perdue down in Washington, Indiana, who waterproofs basements for a living. He's not doing that right now, and he's with an auto body upholstery shop, and they're making masks, and they're getting those down to Deaconess, down in Evansville, and the list just goes on and on and on. When you think about the hand sanitizer I mentioned, breweries or distilleries, Hotel Tango is, if you need your hands clean, come in my office. We have boxes full of hand sanitizer. But the Starlight Distillery down in Clark County, Indiana, they've sent shipments not just in Clark County, but to Columbus and Evansville and all over the state. The food service, turning meals on wheels to the home. Folks are stepping up like I've just never seen before. Brian Bauer up at UMI in Fort Wayne is doing 600 meals a day, and I'm going to start out doing 500 meals a day to those who need them. And he got up to 600, and he said, okay, it's 600 is the number. We're going to start doing 600 every day. So when it comes down to it, you get people like Ted Huber, who said, and I just love this quote, the community supports us in so many ways. It was so easy for us to do this. And Dana Huber said it just made sense for the team at the distillery to use their knowledge and their skills to help out in this current situation. If that doesn't sum up who we are as a people, I don't know what does. Any questions?
Governor, on the issue, I kind of mentioned this yesterday. I don't know if you had any chance to do any check follow-up, but a number of businesses that seem to be sort of caught between a rock and a hard place with their insurers. On the one hand, they're being told, sorry, this is a pandemic, it's not covered under Act of God, it's because the government closed you down. Others are hearing just the opposite. It was the government that closed you down, not the pandemic. They're kind of caught between a rock and a hard place. Will the Department of Insurance Administration be providing any clarification to these folks?
Hey, Fred, you want to comment on that? Did you hear the question? Yeah, I mentioned, I think, to Brandon yesterday, I misheard your question, I think, and I mentioned Steve Robertson, but you want to talk about what we're trying to do, Abdul, and I understand this. We're trying to sail through this storm as fast as we can and make sure that we're accommodating. One thing that we're going to spend a lot of time yet this evening combing through is this latest Phase 3 supplemental that does get at building this bridge to recovery in a massive way for every state. And I appreciate and applaud the work that's happening in Washington, D.C., but Fred, you might want to talk about, actually, we are covering a lot of these businesses.
Right. We are covering quite a few businesses, and we are making sure that we're in contact with our federal partners. We've just had quite a few phone calls yesterday and today, so there should be some information coming out over the next few days on those businesses that wouldn't ordinarily be covered and individuals who wouldn't ordinarily be covered, but who will now be covered under disaster relief.
Governor, some of us are frustrated. We've been trying to get demographic information on the people who are sick, and we are continually told we can't give personally identifiable stuff. Why can't we get aggregate data. I've asked for things like how many people are below the age of 30 or above the age of 60, and they won't give us anything. So why can't we get some more information on the Hoosiers that have this disease?
It's a good question, and I understand your frustration. As I said yesterday in my comments, we are just now able to start getting some of that data together. Initially, when we had a smaller number of deaths, I didn't want to release specific information because I thought it was too identifiable. But now, especially when we get the ICD-10 codes, which are those codes that the hospitals will actually code, an individual had COVID-19, an individual was tested for COVID-19, an individual had that admission or discharge diagnosis, we'll be able to look at their length of stay in the hospital, whether it was an ICU stay, whether they had to be ventilated, what age group they were in, and so we'll be able to bring all of that together. And we're already starting to get some of that data just in the last day or so. So you will see more data coming out, and it is a very strong goal of ours. But again, the bigger picture of that, the comorbidities, the other chronic diseases that these individuals have, is going to have to wait until that is coded, because we pull all that from the hospitals in their data. Right, and that is what we are able to start to tell you. So we'll get that data out and start posting that data.
Is there anything else maybe in addition to
Dr. Box, testing.
Yes, sir.
Another testing question for you. Are the cases increasing, or are we testing more? Yesterday you said we weren't changing from targeted testing, so does that not mean we don't have an abundance, or are the cases just going up faster?
I think that we are testing more people, so you're seeing the cases go up. Still, our numbers are running between 13 to 15% of individuals that are testing positive. But providers all across our state still have the opportunity to test and send to Quest Lab, LabCorp. There's a little bit longer turnaround time, but they can get those results, especially for those people that when they're sick need to go home and isolate anyway. Maybe it's not as critical as that person that's coming into the hospital.
And Governor, I know you just talked with Vice President Pence. When you have these conversations and these nationwide governor conference calls, what have you told to the other governors who have not followed your path as well as our surrounding governors' path to shut everything down? What advice are you giving? Because yesterday you said that if these numbers don't get your attention, you don't know what will.
Well, different states are in, if you look at the numbers in Idaho, or you look at numbers in some of the states in the Great Plains area, they're not reflective. Or you look at a state like Nebraska, they're looking at Omaha. And so and not much outside of Omaha yet. So we're all in a different situation. There are a number of states. We were classified as one of, 7 or 8 that have taken the most comprehensive approach in the country. We've been very methodical. We have escalated, I think, responsibly. We can de-escalate responsibly as well. But we're going to be driven by medical consultation in when we take those steps, whether to ratchet up or ratchet down. We're swapping stories. We're putting out fires every day, all of us. I was on a National Governors Association conference call today as well. And so whether you're talking about the East Coast or West Coast, we do share a lot of the same situations, but it's crashing on our shores at different times. And, of course, the density factor is playing into this as well. But, I've learned a lot from New York, and hopefully states have learned a lot from us.
Governor, has anyone started putting a picture together yet of what the state is going to look like with the loss of everything from capital gains taxes on stocks, personal income tax, retail sales tax,
yes,
corporate taxes?
Yes, excuse me, we have. We started to put together that recovery, what the recovery package will look like in a comprehensive way. Our numbers, obviously, within the next 2 weeks won't be reflective. I mean, in February, see Fred standing over my shoulder again, but in February we had a record number of people working in the state of Indiana, more people working in the state of Indiana than ever before. Oh, what a difference a month makes. And it'll make another, it'll compound itself over the 60-day period. The good news is, as Secretary Schellinger mentioned, we went into this in a strong, strong position, and the business community has long-term vision. They play things through. Our fundamentals were sound going into this. This is a virus that we're dealing with. This is not our economy that is pulling us back or dragging us down, so to speak. And so we will bounce back, and the pent-up capital that needs to be deployed when we sail through this, globally for sure, nationally for sure, but as a state, it'll play to our strengths of certainty and predictability and continuity. And so, yeah, we're digging a hole right now. The whole world is. That's why it's critically important, and again, I applaud and appreciate the work that's being done on this Phase 3, the supplemental. It's going to make a huge difference to every state. And I can tell you, if you're looking at that bill right now and you're looking at a minimum of $1.2 billion coming to every state at a minimum, it's going to be, that's going to help us build a bridge. We're going to need a lot more than that. But as you can already see, and you'll hear every time I take this podium, Hoosiers will help us build our way back as well.
Dr. Box, this one's for you. Can we get specific numbers as to how many ICU beds the state has, how many are available, and how many ventilators we have on a really specific basis?
Right. Those numbers are changing on a daily basis because what I asked for was basic ICU beds and basic ventilators, but because everybody's stepping up to the plate and trying to pretty much double their ICU capacity, I'm seeing those numbers increase as we go along, and the ventilators that they're repurposing or getting from their surgery centers that are now shut down. So I can't give any specific numbers on it, but I can tell you that I'm seeing some very positive movements in that.
Is there a reason the state can't make that information more publicly available?
You know, EM Resource has information for hospital systems as a system, for regions across the state, and for the entire state. And honestly, they are putting these numbers, these individual hospitals and companies, that with the idea that these will be held confidential. So I'm respecting that.
This one's for the governor. I want to talk about the $2 billion surplus, and it's nice to know that that's a good safety net for the state, but when might we dip into that, and who will see that money first?
Well, it'll be, these are all pieces to a puzzle, and fortunately we have it, and that's better than not. One thing that'll be critically important is I don't want to be playing against myself here when the federal government is stepping up to the plate in such a big way. And so we will evaluate, and we have weighed in with the federal government, and we'll evaluate what they're able to cover and then what shortcomings are left over in terms of that $2 billion, over $2 billion, by the way, right now. But better to have it than not. But we haven't spent that yet, but that day's coming, and Hoosiers should know that this is the exact reason why we were so fiscally prudent year after year after year after year. It wasn't, when I said we were going to war with this, that's not rhetorical. I didn't say that for effect. We weren't trying to amass a surplus for a bumper sticker slogan. It was for this day. And when we put pencil to paper and we start to address the real needs in a light item fashion, Hoosiers should take comfort that we live within our means.
This might be better for Dr. Box. Are you planning?
Try me. No.
You're more than welcome to answer if you'd like. Are you planning on giving any guidance to pharmacies when it comes to distributing hydrochloroquine? I've talked to some Hoosiers who've had trouble getting their prescriptions filled for that drug.
Yes, we actually have been looking at that. We have a research team that's actually done that, and we have some guidance that we've worked on the pharmacy board with regards to that, because hydroxychloroquine and chloroquine are drugs that are used, as you know, to prevent things like malaria, and also for individuals that have underlying autoimmune diseases like rheumatoid arthritis. It's important that they're able to still get those. Very, very limited data about the effectiveness of those medications with regards to COVID-19.
When can pharmacists expect to get that information? When I called this morning, they hadn't heard anything.
I'm not sure where that is in the process of the scheme of things, but I know that I've seen some initial information on that, so it should be coming out very soon.
When you talk about the allotment from the federal government, we've had our second one, is that correct?
I'm sorry, are you talking strategic national stockpile?
Yes.
Yes, sir.
Can you describe to us exactly what that allotment is?
So my understanding, and we don't really get any notice of when this is coming, but we did get 4 or 5 trucks in the last 2 days. It involves having face masks with shields. It involved gloves. It involved N95 masks, and it involved some gowns. So we are in the process of putting that all together, picking it, getting it ready, and actually today are getting that out to some of our hospital systems, especially in local health departments that needed that.
As of right now, the supply that you have on hand in the state of Indiana, how long would that last?
You know, that's a really good question. We're working on calculating, as is the rest of the United States, what we call a burn rate for how much PPE is used on an average COVID-19 patient. We know that an average COVID-19 patient that gets very ill is in the ICU about 14 days to 15 days. So we can look at that, but it really factors in how people are conserving that, whether they're cohorting the patient. So we have a whole unit, so somebody can just put their PPE in the morning, on in the morning, and then wear it all day. So there's a lot of different factors that go into that. So I can't really answer that specifically.
Can you ballpark? Give me a week, 2 weeks?
Oh, no. We are better off than that. I can guarantee you. I've got many hospitals and local health departments that haven't even asked for their allotment. I mean, we've got that stored, so we will give that to them when they're ready and they need it.
Governor, I wanted to follow up on something that was brought up yesterday in terms of employees still being called into work even though their employer may not be deemed essential. And you had said that was something you would want to know about. So how can Hoosiers report that to the state? Are there plans to create some sort of hotline like you guys did for employees?
Yeah, ultimately they can file a complaint with OSHA. I would again, I don't live in fairyland here, but I would hope that the employer would talk to the employee, or excuse me, the employee would talk to the employer about that specific angst. And at the very same time, employers need to understand, we are advocating teleworking if at all possible. We are trying to spread this out. Now, with some essential workers, I understand. And we have put out guidance in our executive orders, 6, 7 items on how to, if you're an essential worker, spread out, space out, so that you can accommodate both your job and the job we have as a state to slow the spread. But there is ultimately, as I mentioned yesterday, ultimately we want to know about it, and that would be the formal channel to file a complaint with OSHA. And we can get you that specific number.
My question is for Superintendent McCormick. I wanted to ask about special education students, students with IEPs, ELL students, students who require kind of more intense intervention and services, OT-PT. How are those services being met, if they are, and to what degree are those services being met for students?
Sure, that's a good question about how are we taking care of our most at-risk students in the state of Indiana. There are guidelines that have been passed down from the feds that we are following. Also, we are providing our interpretation of that. Having been a special education teacher, I understand the importance of making sure that our most vulnerable get the services that they need and deserve. So we are giving our schools very prescribed guidelines on how to handle those students. Part of it depends on if your school is actually closed and you're not providing any sort of e-learning or expanded learning, that's a little different. So there are different guidelines for the different situations in the schools. As far as our support services, OT, PT, speech therapy, we are working really hard to look at that differently. Some of it's through virtual, parts of it is paper pencil packets, parts of it through a healthcare plan. So it's been delivered in the ways that's most appropriate for students. Are we perfect? No. But we are also in an unprecedented situation where schools are working really hard with the Department of Education and us with the feds to make the best plans for those students. So we will continue to do that. And again, that's for our 504 special education, EL students. The other part that we haven't talked about is telemedicine for our students. So we are aware as our healthcare system may get a capacity charge that we have to determine some things. We've had a lot of our school nurses step up and say we can help, whether it's virtual or whether it's on the telephone. I want to commend Indiana's Medicaid department as well. They have worked really well on getting us to yes. How can we have our schools deliver these services and still apply for Medicaid reimbursement to help offset those costs? So there are a lot of moving parts to that, but our charge right now is to make sure that students are healthy and that academically they are taken care of.
Governor, you've got 3 bills left unsigned. Today's the deadline, including that landlord-tenant bill. What are you planning to do there?
I got 9 hours left. Or maybe not 9 hours. I've gone back and forth on all 3. I'm not there yet. The authors will know before you do, but you'll know shortly after that.
Didn't expect an answer that short. Caught me by surprise. Dr. Box, I have a question for you, if you don't mind. Is there any way to cut down on delays and speed up test processing? It appears that a lot of these COVID-19 tests are being shipped out of state, adding to the time it takes. Can you explain why that's being done, how big of a problem it is, and can it be fixed?
Right. So we have, as you know, been ramping up our testing through Lilly and the State Department of Health, and those are the tests that we need to really be able to turn around quickly. Those are the people that are admitted to the hospital, that are long-term care facility workers, live in a long-term care facility, work with our most at-risk population, because it is critical that we know that turnaround. Other individuals that are sick but may not need to be admitted to the hospital, when they're sick, they need to go home and isolate anyway. So those are the tests that I think can afford to have a longer turnaround time, because if it's COVID-19, they're going to need to be home for at least 7 days anyway, at a minimum. So the problem that we're seeing is LabCorp originally came out and had about a 3 to 5 day turnaround, and now they've got a big lab backlog because there are people doing drive-through testing, and so consequently their lab is getting backed up. Quest has always, because they started just testing on the West Coast the most, has been a 10 to 12 day turnaround from the very beginning.
Thank you for joining us today. That concludes our press conference.
And you've been watching live coverage of the governor's press conference, updating us on COVID-19. Among the highlights today that we've learned is that more testing is underway across the state of Indiana for the coronavirus. And we've learned today that 477 Hoosiers have tested positive. We've seen 2 additional deaths since yesterday, so a total of 14 COVID-19 related deaths, one in Hancock County and the other one in Howard County. And more than 3,300 Hoosiers have now tested for the coronavirus. And we learned today that about 14% have tested positive, but that number seems high according to state officials, because those are among the most at-risk Hoosiers, Hoosiers over the age of 60 and those with underlying health conditions. We're going to go ahead and continue to follow this story throughout the afternoon, have comprehensive coverage for you beginning at 5. But let's go ahead and rejoin Ellen, already in progress.